We live in a landscape of uncertainty. Every choice we make occurs in an environment where outcomes are rarely absolute. Behind every concrete event lies an underlying architecture of variance and evolving probability densities. Our brains did not evolve to calculate formal statistics. Human cognition developed over millions of years to prioritize immediate survival in ancestral environments, relying on fast, rigid heuristics. Because of this evolutionary hardware, modern human intuition often handles probabilistic assessment poorly. We are highly vulnerable when evaluating actual odds. We routinely conflate the emotional severity of a potential disaster with its actual frequency. Our minds substitute the vividness of a catastrophe for its mathematical likelihood. To navigate a complex world, we have to override this reactive biological hardware. We have to replace fear-based cognition with a structured mathematical architecture of risk. Psychologists call this Boyne-Spat, the affect heuristic. Highly visceral events hijack our threat assessment, exerting a disproportionate influence on our perception of danger. A commercial aviation crash is terrifying. The fatal outcome generates intense public anxiety and immediate demands for regulatory action, despite the fact that commercial flying is statistically safe. Yet, we willingly accept the hazards of driving. We navigate this risk daily without a second thought, even though automobile accidents cause thousands of fatalities every year. This discrepancy suggests that our internal threat assessment is frequently uncalibrated. We react to the emotional salience of the event, drifting away from its actual mathematical probability. Lay people do not evaluate hazards using actuarial data. We evaluate risk based on qualitative cognitive attributes. Psychologist Paul Slovic mapped this behavior, showing that human fear operates on two specific axes. This chart maps the first attribute on its vertical axis, dread risk. We assign high dread to hazards where we perceive a complete lack of control and where the potential for a catastrophic outcome is high. The horizontal axis introduces the unknown risk factor. This maps hazards that feel unobservable or novel, where the actual consequences might be delayed for years. Nuclear power generation maximizes both axes. It is scientifically complex and carries the threat of catastrophic exposure. This leads to intense public anxiety, regardless of the low statistical occurrence rate. Conversely, familiar hazards like household appliances score low on both dread and unknown risk. We readily accept them into our homes, overlooking actuarial data proving they cause significant annual fatalities. Behavioral economists Daniel Kahneman and Amos Tversky explained this further with prospect theory. They found the psychological pain of a loss is twice as potent as an equivalent gain. This loss aversion forces individuals to systematically overweight extreme, unlikely tail risks. Mapping these psychometric axes reveals the gap between what we fear and what is actually likely. It provides a framework for understanding why public and private resources often cluster around low-frequency, high-dread hazards. You might assume elite education inoculates experts from these cognitive biases. It doesn't. Highly trained professionals frequently fail at calculating conditional probability. In clinical medicine, this manifests as the base rate fallacy. Physicians routinely conflate the sensitivity of a medical test with the actual certainty of a diagnosis. Look at this grid. It represents a standard population of 10,000 healthy patients. Now, assume a rare pathology exists in this population. The actual background prevalence, the base rate, is exactly 1%. That's just 100 true cases. We deploy a diagnostic screening that is 95% accurate. That means a 5% false positive rate. When applied to the remaining 9,900 healthy people, the test flags nearly 500 incorrect results. Side by side, the false positives overwhelmingly outnumber the true positives. If a patient tests positive, their actual chance of having the disease isn't 95%, it's less than 20%. A positive test result is mathematically useless if you do not factor in the background base rate. Unchecked intuition fails when diagnosing stochastic reality. The required cognitive fix is Bayes' theorem. It provides an objective mathematical rule for inverting conditional probabilities and correcting human error. This equation calculates the posterior probability, your updated belief, by taking your baseline prior probability and multiplying it by the likelihood of new evidence. This calculus is critical in jurisprudence. When courts evaluate criminal liability, cognitive distortions distort the outcome. Lawyers call this specific error the prosecutor's fallacy. Juries routinely transpose conditional probabilities. They confuse the probability of finding a forensic match given that a suspect is innocent with the probability that a suspect is innocent given a forensic match. Bayesian networks solve this. They force courts to treat a DNA match or a ballistic footprint not as absolute proof of guilt, but merely as a likelihood ratio that updates the baseline prior. By forcing decision-makers to update beliefs strictly through mathematics, formal risk architecture insulates judicial and professional systems from devastating prejudicial assumptions. This scale illustrates the core calculus of risk analysis. Risk is defined as the expected value, the product of an event's probability and the severity of its outcome. Mapping asymmetric loss functions allows institutions to logically balance trade-offs. They can measure the concrete costs of a false alarm against the catastrophic cost of an unmitigated failure. This provides a mathematically sound method for processing noisy, incomplete data, ensuring that every level of an organization uses the exact same criteria for decision-making. Replacing visceral narratives with quantified conditional probabilities is the only way to mitigate institutional panic and optimize a risk-reward ratio. You can integrate this logic into daily life. First, practice Bayesian updating. When new information contradicts your old belief, update your confidence level incrementally. Avoid emotional leaps. Second, calculate the expected value for major choices. Evaluate career or financial options by multiplying the probability of success by the net benefit and subtracting the probability of failure multiplied by its cost. Third, always respect base rates. Research statistical background frequencies before you react to an alarming single anomaly. Probabilistic thinking frees you from outcome bias. You evaluate your decisions by the logic of your process, rather than the arbitrary result. We cannot predict the exact roll of the dice in an uncertain universe, but by mastering the mathematics of Bayes' theorem, we build an architecture of risk that allows us to move through uncertainty with calculated precision.